So my journey to becoming a rural physician started in 8th grade. I started working actually with a solo private general practitioner at home. Baraboo was my 3rd interview. It was in early December. And I just walked in and I said, I know what this is. This is what I was doing at home. This is family medicine in a small town where you take care of the kids and you have close relationships with your specialists and your surgeons who are around, and people just knew the community.
This site specifically, what brought me here was the residency program, because I liked the opportunity to be able to continue to teach and to train rural family physicians, but also to have my own practice.
This program's greatest strength is that there is a culture of helping residents learn and of inviting residents to learn. Whenever I ask for more calls on OB, for more deliveries, I get them. We are affiliated with the University of Wisconsin-Madison program, and our interns are really indistinguishable from the other first-year residents in Madison in that they do the big rotations at large hospitals there. And then their 2nd and 3rd years, they come up here to Baraboo and they move to the community, become a part of the community. And we really are the healthcare providers in the community. And our residents learn what it's like to be managing a patient in labor in the hospital and running back over for their outpatient clinic. They really learn what it's like to practice rural medicine because that's what we're doing here. This is an area that attracts several tourists from out of state, especially to the Dells area, and we're the closest level 3 trauma center to the Dells. So due to the tourism, we get a bit more complexity than we would otherwise.
We have excellent surgeons here who are our C-section backup, and they're very comfortable with and used to working with residents and training those who have interest in getting C-section training. Being in a rural setting, you get to experience what it's like to have patients who either can't or won't drive 50 miles to see a specialist. So you end up in a situation where in family medicine, you're handling much more medical complexity than you would in an urban setting where your specialists and your referrals are right down the hall. There's a lot of value in training in that setting.
So our longitudinal curriculum over the 2nd and 3rd years includes time with the specialists in adult medicine, time with the hospital physicians here, the hospitalists as well as us, and it's not a block. So you don't just see cardiology or pulmonology or rheumatology or pediatrics.
One of our unique features here in Baraboo is that we have an affiliation with the Ho-Chunk Tribal House of Wellness, and they care for the Ho-Chunk population in the area. All of our residents rotate through the House of Wellness, and some get even more involved and do more of a longitudinal experience where they spend a lot of time out there.
Our residents are involved with a community health rotation when they start here in 2nd year, which puts them in touch with the prenatal care coordinators, public health nurses, which they then can utilize on a longitudinal basis to help connect their patients to resources in the community. And they have been actively involved in the diabetes education series for many years.
Because this is a rural area, the housing market was much more affordable than it would be in a different area. And we were able to buy a house that is 400 feet from the hospital. And the lack of commute time, parking time, and all of those extra things that eat into your life when you're in a bigger area frees up your time to do clinical care or have your own free time. We start as interns with the Madison residents in the same cohort, and they don't think of us as separate from themselves. And so after that year in Madison, we're always welcome to do a rotation in Madison, and we're always welcome to do any social events with the Madison residents.
I think the residents consistently feel like they get the training that they need to go be in a rural setting. And that's our main goal. We're a rural training program and we want to train rural physicians. There's a crisis in healthcare right now where not enough of us want to be in rural areas, and we really want to be a part of that solution. So residents feeling like they can go out, be rural family physicians.
One of them, she felt she got a great educational and academic foundation with the UW curriculum, but where she learned how to use those skills was in Baraboo.